Awesome. Well, why don't we get started and we'll welcome folks as they join. I know it's a busy time of year, a busy day, but just really excited to get us started. And I want to thank you all for joining our session today. So, as you all know, this webinar is part of our Capital Conversation series, where we bring together leading experts, advocates, and partners to explore timely policy issues and their impact on our work. So today's session, which is titled Reconciliation 3.0 and What's Further at Stake for Medicaid, we'll hear more regarding congressional efforts related to a third round of budget reconciliation and what it might mean for Medicaid. We'll explore the likelihood of any further action as the House presses forward with the midterm elections also in sight. Additionally, we will hear about emerging efforts to track Medicaid-related changes state by state and how our members and our member panelists here today are engaging state leaders as these developments continue to unfold. So we are pleased to be joined by a terrific group of speakers this afternoon, including Kate Brady, co-director of the Grassroots project at the Human Services Research Institute. We're also joined by Nick Gwyn, Senior Fellow for Government Affairs at the Center on Budget and Policy Priorities, Chris Koenig, who serves as President and CEO at Niagara Lutheran Healthcare Systems, and Margaret Nimmo, Chief Strategy Officer at enCircle. So we're grateful to all of our speakers and for all of you here today, and really excited to see what everyone brings to the conversation, and want to pass it off to you, Bill, to get us started. Thank you.
Thank you, Alicia. First of all, we welcome our speakers and we welcome you as members to participate in our webinar. And we want this to be a very interactive session. So please use the chat box, ask questions of our presenters, ask questions of us. We really want this to be interactive as much as possible. But before we formally begin, we'd like to ask you to complete a one-question poll to help us gauge everyone's level of knowledge on our subject today. What we're talking about today is how would you rate your current level of understanding regarding the Medicaid changes connected to the federal reconciliation efforts at the state level? And so everybody's starting to fill that out as we go, so I'll let you guys do that. It says pre-test. It's more of a pre-question. So it looks pretty good. We have about 9 people with moderate understanding, 3 people at strong or very strong, and then a few people with limited. And so hopefully this presentation will answer some of those questions for you. And you do have some experts here on the line, so it'll be a great opportunity for you to ask them those questions. All right. Well, thank you. As we begin today, I really want to provide a brief overview of where things stand legislatively. So just a policy update. I'm not going to go into great detail on that. I do want to point you to our capital communications that have been coming out each week. They go into much more in depth on each one of these pieces and some other things that we're following. But we wanted to bring those to the webinar just to have a brief conversation about them. As we know, there's new Medicaid pressures on waste, fraud, and abuse efforts, and those will continue to escalate. There's been recent federal actions that signal a significant escalation in Medicaid and Medicare waste, fraud, and abuse enforcement with major implications to providers, particularly in HCBS and hospice and health services. And as we know, there was some recent documentation about California. So it's just something really pertinent for you to follow. And we'll send the link of our capital communications here in the textbook that will allow you to kind of do a deeper dive on that. A second one, and this is kind of it is a celebration, but there's the new 21st Century Road to Housing Act. And this was actually passed this week out of the House of Representatives. It was voted Wednesday to pass bipartisan. And it's designated to boost the supply and help of affordability for those who are reconciled with the Senate, and now it needs to be reconciled with the Senate. Further, and going back the other way, CMS has provided some new guidance pertaining state-directed payments, and this happened on May 20th. On May 20th, and CMS proposed a rule that would cap certain state Medicaid payments and align them only more closely with the Medicare rates. This proposed rule will create new limits in Medicare state-directed payments and certain fee-for-service payments to reduce Medicaid spending. It's just another effort to kind of manage and control those costs. And so we'll be following those and providing updates on those as we go. And then finally, Wyden Senate Democrats unveiled just this week plans to improve long-term care amid Republican attacks. And so those Senates revealed a plan to create incentives for more home care services, staffing, nursing homes, and robust care workforce. Latest, dear colleagues, come as Republicans the latest comes as Republicans cut billions from Medicaid, worsening home and community-based service with disabilities. The one thing that I would make note about that piece is that they are opening their door. They're going to have an open office hours between now and the end of July. And so we're going to be working with members to identify feedback on their proposal and where we think it could strengthen the services and what concerns we have going forward. It's a real opportunity to share your voice. And I think you're going to see some legislation very similar to this as people prepare for the midterms, wondering who might be in control of the Senate and the House with that. So I think this is an effort for them to be in position when the fall hits, if they were to take control of the House or the Senate, to have a bill that was ready to pass. So an opportunity to inform on that policy will be in front of our members here this summer. Next slide, Chris. I want to point out we continue to share with you guys about our Here We Stand for People and for Care and Medicaid. This is our ongoing defense to support members in protecting Medicaid. And we are open to office hours. We're going to be having a lot of opportunities for you guys to continue to hear more about that if you haven't already heard. But just to kind of break it down in some simple terms, there's two approaches. There's the federal piece, which we have a fact sheet that goes in great depth about the services that are provided and how Medicaid affects that. We have a messaging tool. We have easy, usable social media tools that you can connect with your own social media efforts and your marketing. And then we have communication resources. And we'd love for you, if you're interested in engaging further with federal lawmakers, to use these tools as you have that communication. But as we know, a lot of the communication is starting to switch from the federal government to the state government. And as HR 1's implemented amidst the state budget challenges and ongoing efforts, we want to support you as members to be able to use those same tools at the state level. So we have a messaging tool and we have communication resources, and we're starting to identify some key states where we feel like we can provide some more of that information. And Kylie's providing a lot of the resources there. But we really want this, and we'll talk about this at the end. We want you guys as members to be able to take that information and plug it into your own marketing and advocacy tools in the state. So we'd love to have conversations on how they're working for you and how we can help in that effort. There's some additional resources supporting integrity of Medicaid and how the people we serve. This is a news brief aimed at supporting members to navigate their fiscal challenges. And then finally, our action guide. The action guide really includes suggestions on how to engage legislators, communication-related efforts. And then last but not least, our Partnership for Impact guide. We continue to build upon this initial focus and would love, we have webinars out there that you can see again, that where we go into more in depth about how those measures aligned with supporting value-based payments approaches. So just those are our updates from our end. And now we're going to switch over to Nick Gwyn, and I'm really pleased to have him join us today and talk to us a little more about Reconciliation 3.0. Thank you, Nick.
Thanks, Bill. And thank you to everyone on this call for all that you do every day to help people in need. If we can pull up the slides. Thank you. So I was asked to chat with you all a little bit today about whether Congress might move forward on a third reconciliation bill. So if we can move to the first slide. I guess the first question really just to remind everyone, what is reconciliation? Well, reconciliation is a two-step process by which Congress moves on legislation that has major spending effects. The first step is that the House and Senate agree to a budget resolution that kind of outlines broad policy and which committees are going to be required to report out future legislation. The second step is both the House and Senate agree on a actual reconciliation bill that includes the specific policy and spending proposals that then go to the president's desk. The benefit of moving legislation through this process is that it's not subject to a filibuster in the Senate, which means it only requires 50 votes for passage in the Senate. But there are some limitations to moving bills through the reconciliation process, including a requirement that all the provisions within it have more than an incidental budgetary impact. So this is really meant to be a vehicle for significant spending or tax legislation or both. If we can move to the next slide. So as you all painfully know, we've already used this process once. Last year, HR 1, also called the Big Beautiful Bill and a variety of other names, passed through the reconciliation process. And we're already seeing the effects of that bill in terms of the huge cuts that it made to both SNAP and to Medicaid. In SNAP, we already have 3.5 million people who have lost those food benefits since enactment. We expect those cuts to grow, especially as states grapple with huge cost shifts that are coming their way under that legislation. And so really significant impacts in terms of people who are struggling to buy groceries. On healthcare, we had kind of a double hit. The legislation did not include an extension for the expiring premium tax credits under the enhancements, I should say, under the ACA. And even as it extended a variety of other tax credits, including some to the very highest income people in our nation. As a result, we already have over 1 million people who have lost health coverage through the marketplaces, and we expect bigger declines when we start to see more data come out this summer. The legislation also had the biggest cuts in Medicaid in the program's history, and those cuts are now being implemented. We're starting to see the very beginning of the implementation of the work requirements for the Medicaid program. The first state, Nebraska, has already begun to implement. All states have to implement before the end of the calendar year. There are estimates between 3 and 7 million people losing their Medicaid coverage from that provision alone. And there are other provisions that affect Medicaid, as you all know. So really drastic effects. Some of those effects will be determined by exactly how states implement these requirements. So there might be some things that states can do to mitigate the worst outcomes, but I think just given the breadth of these cuts, we're going to see cuts across the board in every state. Next slide, please. So just to give you a quick idea of some of these impacts, this is in Arizona in terms of what we've seen for the number of people who are receiving SNAP food benefits since enactment of HR 1. Arizona is at the moment an outlier. This is the biggest effect, but we're worried that this could be a signal about where some other states might go when they fully implement. And as you can see, just a dramatic drop, a cut in half of the number of people who are receiving those food benefits in that state. And this is not because of a decline in employment or decline in need. Those have held relatively steady. This is just a variety of things that state has done to make it harder to both get and keep SNAP benefits. Next slide, please. And this slide is reflecting kind of where we are with the ACA marketplaces and what's happened with the expiration of the enhanced premium tax credits and the effect that's had on the costs that consumers now bear for their health coverage across these various years. And you can see the huge uptake or the uptick in 2006 and in 2026 in terms of costs. Next slide, please. So now that was the first reconciliation bill. Now Congress is working on a second reconciliation bill, which is primarily focused on funding ICE and Border Patrol. The House and Senate have already taken that first step in which they have agreed on a budget resolution. And now the Senate is considering the actual follow-up reconciliation bill that includes the specific funding levels for ICE and Border Patrol. And as you'll have probably heard in the press, there was also an effort to include funding for President Trump's ballroom in that legislation, which has run into some trouble with the rules that are required within anything that goes into reconciliation. And as I mentioned earlier, that can knock things out. The Senate parliamentarian ultimately has is the decider in terms of what items in a reconciliation bill don't comport to the requirements for that process, and the ballroom funding has run afoul in that context. So right now, the Senate Republicans are trying to figure out how they're going to potentially redraft certain provisions in that bill to make them more compatible with reconciliation rules. We may see a vote on that bill in the Senate as soon as today, maybe tomorrow, we'll see. The thought was the Senate would pass it and the House would quickly pass it this week before both chambers go out for the Memorial Day recess. But at the moment, it's possible that House passage slips because the House members may not want to stick around too much longer, and they may do it when they come back from break. And of course, both the House and the Senate have to pass this bill in identical form for it to go to the president's signature. Next slide, please. So, are we going to have yet another reconciliation bill, Reconciliation 3.0? Well, the Speaker of the House has strongly suggested he intends to move quickly to another reconciliation bill after concluding this Reconciliation 2.0 that's focused on ICE funding. We've seen a variety of press reports that House Republican leaders are meeting internally to try to figure out how they're going to move toward that goal. And it's worth noting that some of this process also relates to trying to corral the votes for the second reconciliation bill that still has to come back to the House. And there are people that would like to see that bill become much larger, or would have preferred that bill to be much larger. And therefore, they will be pressing for Reconciliation 3.0 in discussions with the Speaker. On the other hand, in the Senate, Majority Leader Thune has been much less committal about moving toward a Reconciliation 3.0. There's not as much, I think, pressure from some in his caucus to move in that direction, although there are some leading Senate Republicans who would like to do so. But I think it's safe to say that there's more pressure in the House at this moment to have a third reconciliation bill than there is in the Senate. And one thing to remember is that, we've only got in the House roughly 25 legislative days, I should say, before Congress starts its scheduled recess for August. So there's not much time to really go through the kind of difficult, arduous process of getting to the end of a reconciliation process. So if we can move to the next slide, please. So what might be in a Reconciliation 3.0 package? Well, the short answer is we don't really know. And partly that's because the House Republicans are still debating that issue internally. There's still discussions about what might be in the package. We do know that the chair of the Budget Committee suggested cutting various basic needs programs to help offset the cost of higher defense spending. And he's mentioned some programs specifically, like the Earned Income Tax Credit. He has not, I don't think, mentioned Medicaid specifically, but clearly Medicaid, if they're looking for money, Medicaid is where the money is in terms of basic needs programs. So it could be under threat there. There'll be a discussion certainly about a variety of so-called anti-fraud proposals. And in some cases, these might be relatively narrow and basically focused on fraud. In other cases, they'll just be a different form of cuts in benefits by reducing access to various programs. And there'll be some potential proposals that will suggest they are looking broadly at reducing fraud, but threaten to hold up funding for a variety of programs, including Medicaid, which we've already seen in several different circumstances under the Trump administration in which they've blocked funding for certain states with allegations, often totally unsubstantiated allegations of fraud. There's a bill that recently was passed out of the House Oversight Committee, HR 8464, that would allow federal agencies to delay, condition, or segment federal payments until if they had sufficient reason to determine there might be an elevated risk of fraud. And the agencies themselves or the Department of Treasury will be left to determine whether certain funding met that threshold. And again, given kind of what we've seen already from this administration in withholding and blocking funding, any proposal to provide further authority in that direction would be of great concern. So that's a bill that might move independently by the House, or it might find its way into a future Reconciliation 3.0. In the Senate, the Budget Committee Chairman there, Lindsey Graham, has said he'd want to see a quote unquote down payment on the SAVE Act. And that is the Republican legislation that would impose new restrictions on voting. So that could be an item that goes in that bill. And there might be some discussion about things that are, being pitched as affordability provisions. Unclear exactly what might fall in that framework, although we might see some tax proposals. Obviously, the president has talked about some kind of temporary elimination of the federal gas tax. I don't know if that will be there, but certainly an item that is floating around. Next slide, please. So just in conclusion, as I mentioned, the House is more likely to move on Reconciliation 3.0 than the Senate. Overall, it does seem like a rather tall order to me for Congress to complete another whole reconciliation process before the midterm elections. But having said that, there's a lot of risk here if they do move forward on a 3.0 package. And so I think that speaks to the vigilance that we all need to have as we continue to watch what might happen in the House, and then to kind of see what posture the Senate takes related to any potential House action. And Bill, I'll leave it there and send it back to you.
Thank you, Nick. That was great. I want to see if there's any questions in the chat. I do kind of you did a great job of summarizing that and the kind of the conversation we had last week. I think there's the time limitations they have. They have the hurdles that of the things that they would like to have on the bill, both from the Senate, and then of course there's the appetite. I know that we just had our advocacy day in April, and on the Senate side, it sounded like even then there wasn't a lot of desire to move forward with the one, and they didn't think that would move forward. On the House side, I think there was some appetite there, but then they were disagreeing. I think you already kind of phrased it, but the idea that what do you think the biggest challenge is? It on the House side and agreeing on specific pieces to it, or is it, or is there a certain legislation that we should point just reinforcing the importance of our services and the values that it provides in their communities?
Yeah, it's not exactly clear. I think overall the Senate will be a bigger hurdle than any disagreements that may occur in the House, but the House has its own set of challenges just to get a bill up. Again, they've got to go through the kind of this two-stage process, and whether the Senate would even follow through on the first stage of that, which is a budget resolution, and is fairly general. There's not a lot there, but there are definitely some in the Senate and actually some in the House Republican caucus that are, I think, very reluctant to go down this path again, given the huge changes that occurred already in the first reconciliation bill in HR 1. And really, in the context of Medicaid, states and providers are dealing with these not only the huge cuts that came in HR 1, but also all of these discussions around fraud, all of these threats to withhold funding, and trying to grapple with both of those at the same time is hard enough. Throwing another set of Medicaid cuts on top of that, I think, would just be beyond disastrous. So I do think at this point you don't know what the specific policies might be, but I think highlighting the environment that all of you are operating in, and if you're providing services that are funded in any way by Medicaid, it's just that it's already extremely difficult to navigate these waters, and many will simply drown if more is added on top.
Thank you, Nick. I don't see too much in the chat there, but really appreciate your continued partnership with LSA and our advocacy and providing real-time information of where things are at. Thank you for your presentation, and you're welcome to stay on and see as the conversation goes on. If not, we will see you soon.
Great, appreciate it.
All right. Well, it is my pleasure to introduce the next speaker, Kate Brady, and I'll have her be pulled up here in a second. But Kate and we had a Zoom meeting last week to kind of connect on her presentation and realized that during the pandemic, we spent almost a weekly meeting each week on advocacy work, but hadn't made the connection that we knew each other until both of our faces popped up on Zoom. So I'm very excited to have Kate here and present on the project she's working on. Thank you, Kate.
Thank you, Bill. Yeah, it's such a small world that we work in. I'm sharing a slide now. Thank you to Lutheran Services for having me, and thank you to Nick for that great overview. It was really, really informative. It's a complicated and grim time we're in. And that really is the context of the work I'd like to share with you. Can you hear me okay, Bill? Yeah, okay, it looks like, yeah. And you've got the slides. Do you have
Yep, we can
slides?
see the slide and we can hear
Okay,
you perfect.
great.
Yep.
Good. So this work that we are doing in partnership with the Milken Institute School of Public Health at GWU, as well as the Leading Age LTSS Center at UMass Boston and ATI Advisory, is an HCBS impacts tracker and information clearinghouse. And the context of that work is recognizing the massive flood of changes that we anticipate seeing at the state level as a result of federal actions, and wanting a way to capture and present those to the community in a way that is useful. So that's what we are up to with the support of the SCAN Foundation and the WITH Foundation. And I work at the Human Services Research Institute, and we're a partner on this project. So that's the context. I think I've probably blazed through that slide there. So there you'll see our partners. The lead on the SCAN project is GWU, where Allison Barkoff is the principal investigator, and she wasn't able to be here with you today, so here I am. Some background, as Nick alluded to, there have been federal policy changes, including the cuts to Medicaid financing through HR 1, and so states are under increased pressure as it relates to their Medicaid budgets. We anticipate seeing changes to home and community-based services, recognizing that funding is optional. And so that is the area of focus that this tracker has. There are a great many other trackers available, but none focused specifically on home and community-based services and services to older adults and people with disabilities to live in their homes and communities. So that's what we are focusing on. And we are looking at the types of changes to HCBS, recognizing that their impacts can be very difficult to detect, and that it requires an interpretation of state budgets, of proposed HCBS rates or state-funded services, and that being able to examine that at the level of state policy and practice as well as population is something that a community of advocates may find really critical as we see these cuts roll out. So that's what we're up to. We're hoping that this effort can help to mitigate harms. We're hoping that as we can look upstream and anticipate if a change is proposed, that may allow for mobilization to intervene and impact before changes are in policy or in the budget that is approved. And we hope that it will build capacity at the state level for kind of shared awareness. The other thing that we're up to is providing documentation. So we know that changes in HCBS policies are hard to track at scale, and we want to be able to look back and say, look at the scale of impact that HR1 had, although there was, of course, a discourse that it wouldn't hurt people with disabilities, and we know that isn't the case. So we want to be able to mark time so that we can move at least back to the time prior to these cuts. And so we're trying to acknowledge the tremendous impact that we expect to see on people with disabilities, family members, and direct care workers. And then I think I've mentioned the future opportunity of addressing or undoing, right, the harms that we see. So some of the specific HCBS reductions that we are anticipating capturing are the elimination of programs, particular programs in states. Thank you so much for putting that link in the chat there, Kylie. That'll show up on your screen in a bit, but I'd love for people to be able to go directly to the website. So we know that we may see programs eliminated. We might see changes in eligibility such that levels of care standards change, and that may restrict who can get home and community-based services. States might choose to reduce the number of waiver slots or cap particular services. We could see reduced capitation rates or cuts to provider rates, and ultimately policies that force people into more congregate supports, right? So if home supports are capped and that doesn't work for someone, ultimately, right, that change, while it doesn't explicitly push people into congregate supports, we know the end result. Some other impacts, right, of HCBS reductions that we're anticipating: decreased utilization, longer HCBS waiting lists. It really pains me to articulate the way that we anticipate a higher use of institutional care, an exacerbation of what is already a direct workforce crisis, increased use of emergency rooms, doctor visits, and ultimately increased mortality rates. And we've already seen the articulation of the expectation that family caregivers somehow do more than they're already doing in an unpaid capacity. And we've already mentioned this increased use of congregate settings, right? So as home-based supports decrease, we see folks move out of their family homes into group homes and so forth. So we're tracking across these 4 areas, and we labored over this as a team to choose what we thought would matter most. So we're looking at proposed and enacted HCBS policy changes, and we're looking across all home and community-based services authorities. So 1915Cs, 191511s, we're looking across all populations that use home and community-based services, and policy changes through all legal authorities. And you'll see as I show you the tracker that we're delineating changes that are legislative, budget changes, waiver changes, and agency actions. So here's that landing page that Kylie has put in the chat for you. And there are 2 things I'd like to call your attention to. One is that first square button that's going to take you to a Google Sheet that is updated every 2 weeks. And that functions currently as the tracker. And I'll talk to you in just a moment about the next iteration that we imagine for this tracker. That second box says HCBS information collection form. And what we mean by that is if you're in that tracker and you see, there's something missing in Kansas, and I know that there's been a budget proposal that they haven't captured, send us that. Please, please, please send us that. What we're not exactly up to yet is imagining that the collection form would go out broadly to the entire disability community and everybody would send us everything they know and think about home and community-based services, right? Because we're only looking for proposed and enacted changes that are due to federal action. So the best way to use that collection form is to have reviewed the tracker and then have an idea about something that you either want to correct or and that might change over time as we get more capacity, but that's kind of where we're at right now. We are reviewing things like news articles, right, that predict changes or that tell the story of the impact of a change. So it's also fun to share those things. The tracker itself reflects only the proposed or enacted change, right? Because we're trying to remain very factual. And because this is a planning grant from the SCAN Foundation, we're really in the iteration phase. We spent months and months building this tracker, and we are going to update it biweekly and hope to expand this effort. But we're open to learning what the community needs. Let me give you a quick look. So the first thing you're going to see when you open the tracker is a how to use tab. And that's important because it will help you know how to sort the various components. So you'll see on the screen here, we can see Maryland, a budgetary change where provider rates were reduced. And there's a new or reduced total program spending cap and more restrictive self-direction policies. Then that next box there is the status. So is that change proposed? Is it paused? Or in this case, it is enacted. We're also capturing where changes have been reversed due to advocacy. And we've seen some tremendous wins. So that's a great, great thing. And for all the ways in which you're able to mobilize the people that you're connected to, the families, and folks who will be impacted, I do think it matters and works. And we wouldn't really bother with the tracking otherwise. It's not an esoteric research effort that we're involved in here. You'll see the next column there is stakeholder advocacy. So we're capturing whether we're aware that the change has been impacted by advocates. Then there's a description, and we try to keep that nice and succinct and accessible. Then we're tracking the dates, the timing of the change, and then providing links that you might need to learn more. So that's how the tracker works. Information collection form. So anything missing, outdated, incorrect, we want to know. And please give us as much information as you can. And of course, you can fill it out more than once over time. It'll be live and available on that website for anyone. And we collect and review that information weekly with a team of state stewards who dive in detail into what you've shared. So know that it matters that you are getting in touch with us. So the next phase of this work, and then I'll pause for questions, is that we have funding from the WITH Foundation to do what is called the MAP-IT project. And this is a project that HSRI is leading. MAP-IT stands for Medicaid Action and Policy Impact Tracker. And it is by design highly connected to the work of the SCAN Foundation HCBS Tracker project that I just shared with you. The difference in this work is twofold. One, it's just a 1-year effort to create a digital visualization of the information that we've gathered in that Google sheet. And we'll be working with the American Association on Health and Disability to provide resources for how to use the trackers so that people with disabilities, family members, loved ones, organized advocates, people in provider agencies, DD councils can make use of the information in a visualized, web-based, map-driven platform in which you go to a website, you see a map of the country, you click on your state, and you get the information about what's going on as it relates to home and community-based services in your state, and then you're provided with some information about how to use that, how you might advocate, and then some trends will be presented that will be have learned about in the process of tracking across the country. So that's that next phase. We anticipate that prototype will be available by late summer, so late August at the very latest. And we're really excited to be able to present that as well, and hoping that it provides another pathway to use the information. We do have an email address if the information form isn't working or there are other questions or ideas you have, we'd love to hear from you. Or if it's just easier for you to send information about what's happening in your state or community, you could email us at hcbstracker@gwu.edu. I'll share these slides with you, Bill, so that you can send them out if you'd like. And I'll put I realize my email isn't here. I'll put my email in the chat, and I'm happy to pause and take questions. I'll bring the slides down.
I mean, this project is great, and we're so thankful and appreciative that you're leading that effort with the team of people that are kind of connected to that. And I think it's definitely going to be able to help, one, for us to keep informed of what's happening state to state, but also to kind of real time work on advocacy as we see things appear. So thank you for that effort. I mean, it's quite an undertaking. I know what the changes are happening, and things are happening, not happening, and then they get undone. So that's great.
Thank you. Thanks for
Any
having me.
questions from the chat? Let's see. We did have some late breaking news that Nick Gwyn had put in there, saying the Senate seems to be breaking for recess, before completing Reconciliation 2.0. So it makes it even maybe less likely the 3.0 will happen. So that's good news. And then you had put your email in there. I think what do you find? I guess one question I would ask is, what do you find most challenging, and how, as a network of providers, can we make sure that we're getting information to you as we see it happening? Just using that tool, and if you have questions, reach out to you guys.
Yes, please do reach out. From my perspective, the most challenging and promising component is the earlier upstream knowledge, right? So knowing a thing before it's too late to intervene, right? So that's something that might be proposed. That's something that, you've been in a policy meeting and you know it's coming down the pike, right? Those are the sorts of things, it's one thing to scan the CMS website, right? Which we'll do when we are looking across those official HCBS waiver documents to capture the kinds of changes you all would care about, right? Provider rates, what's available as far as service caps, those sorts of official changes. But those upstream things, I think, are, from an advocacy perspective, potentially powerful and easier to know about on the ground in the community. So that's where I'm hoping we'll see a sort of groundswell of local engagement. I didn't even mention the Grassroots project, which is a massive network of grassroots organizations that HSRI has convened with funding from ACL. And so we'll have that to leverage. But I'd love to hear from folks.
Great. Well, thank you, Kate. And I would just reiterate, we will send your PowerPoint out to everybody who's here, but also our membership. You guys make sure to forward Kate's work onto your state association community provider so they can have that. And if they have any questions, please get back to us. We'd love to keep informing that work. So we really appreciate your time today, Kate. And we'll switch over. We're going to move on to our membership panel, and we have Chris Koenig, who is the president and CEO of Niagara Lutheran Healthcare Systems, and then Margaret Nimmo, who's the chief strategy officer at enCircle. And we're glad to have them here. And I have a series of questions for Chris and Margaret to kind of get us started. And one thing I really appreciate about both Chris and Margaret is they do a lot of advocacy in their state. They've also been really active in our federal advocacy. And so just kind of, again, trying to make the tie of the tools that we're using and how it's supporting the work they're doing, but also some of the challenges they're having in the state and how they're trying to address that. So the first question to the panel kind of is, what changes or concerns are you seeing in your state level? And we can start with you, Margaret.
Sure. Well, thanks for having me. Here in Virginia, we still do not have a state budget for the next biennium. This has become a trend that we are seeing. We do have Democrats in control of the governor's mansion in both houses of the state capitol, and yet the infighting continues. So there are a lot of distractions. The major holdup really has nothing to do with us and the things that we care about, but it is about tax issues around data centers, and that means there's about $1 billion difference in terms of revenue between the House and Senate versions of the budget. So that is going to have a lot of impact depending on which way that goes. So we are waiting to see what will happen there. And I think the best case scenario is with the Senate's version, there would be a 2% increase in our rates, and the other version, there would not be any. And I realize that is all good news compared to so many other states, but it's definitely not trending in the right direction. And so I think one of the biggest challenges that I see is just airtime. We've been in the news a lot nationally, which is usually not a good thing. And just the redistricting and the sort of fights between federal and state and things going on in Virginia, it feels like it's really hard to get people's attention on issues that matter to the people we serve. So that is one of our biggest challenges, but that's where things stand right now.
Thank you, Margaret. Chris, I'll turn it over to you. What challenges are you seeing in your state?
Thanks, Bill. I appreciate it. Some of the most recent challenges that we've had, there's a big disparity between rates between upstate New York and downstate New York. So New York City obviously is so big. So the cost of living differences, although they're vast, it's a lot narrower than it used to be prior to COVID. So there's been like a 40% swing in the costs. So a place like Buffalo, which is the second largest city versus downstate, but our reimbursement rates for Medicaid could be $100 of a difference. So in previous years, we've tried to shy away from going to the state and saying, we want this increase. Well, instead of just an increase, do we want a percentage or do we want a per diem? Because if there's differences in reimbursement rates, if you have a higher reimbursement rate, obviously more money is going to go to that geographic location. So there's more of an understanding to that, which, when you're trying to talk to, some of these politicians, when their core competency is not what we do, it's really hard to understand these financial pieces. So the difficulty is when you have new and freshman folks in office, you're retraining them for some of these large issues that you've been dealing with for quite some time. I do think we have more traction now than we used to with the politicians. I mean, again, we've been in the news as well. Governor Cuomo during COVID, everybody, the seniors died because of poor decisions, and it wasn't actually COVID. So I think people are understanding the issues, but the difficulty is everybody in New York is having issues. Everybody's going to the politicians saying we're gonna go under, we're gonna die. We're competing against hospitals and various other institutions. So I think what we're seeing is the providers come together more and say, okay, this isn't competitive. If we don't do this, we are not going to survive. And we're giving that message to the politicians, and that they understand. It's the intricacies of if the budget does get reconciled, how that money does get spent. Just one more piece. The biggest issue that we're seeing, that I'm seeing, is the risk is that the state relies too much on the federal match and the federal dollars. And if there's any issues between the federal government and New York State, which there is, I mean, New York State is a very blue state. Last year, they passed the budget, said, okay, healthcare, you're going to get this much money, and we're going to use this mechanism. So to fund the budget, they use what was basically considered a loophole. Everybody will agree with that. President Trump, 2 weeks later, signed a resolution, said you can't do that. So we lost almost an entirety of a budget. Spent all that time with the politicians saying, hey, here's what we got. The federal government takes it all away. Now they feel depleted. So, you're back at square one sometimes with that. So it is constantly changing, but the biggest piece is that the providers having a common message together, and it's not competitive. We need this or it's not going to go well.
Thank you, Chris. I think we talked a lot about that. Those partnerships are durable. They're ones that can move things forward. And I'm glad you guys are both engaged in advocacy groups. That kind of leads us to the second question is like, how is your organization, and you're talking a little bit about that from both of your perspectives, but how are you engaging in advocacy? And maybe I would put a spin to that part of the question of like, are you using some of the material that LSA has been providing, or with your association community providers, what material seems to be making traction or a difference in the advocacy communication? So we can go back to you, Margaret, and then come.
Sure. Well, definitely those materials are very helpful, and the partnership in general. So Holly Rodenheiser, our VP, was up for the Advocacy Day on Capitol Hill, and that was really helpful. And the materials we are taking to our external relations team, and I've got a member of the team, Ariana Estes, who's on the call today. She's our digital marketing person and digital manager and does a great job. She's taking the Here We Stand materials and kind of encircleizing them so that we are using our colors and our branding, which I think, as we all know, is really important, and trying to figure out ways to compromise when you're working with partners to allow everyone's branding, no one's branding, sort of some of those issues. But I think one of the biggest pieces we've been doing to supplement that, obviously, is the storytelling and what's really happening in Virginia and our services on the ground in people's districts. And so for a while, we've been doing a lot of, story banking. So what I mean by that is like collecting stories as they come up, sort of having our eyes and ears throughout the organization. The folks delivering the direct services are focused on that and their amazing work, and sometimes don't realize that their everyday is really exceptional to share to someone who's not in the field. And so our team, every time that we go out, is trying to keep our eyes and ears out for those everyday stories of how amazing it is when people can have a life in our community and engaged. And then we try to tell those stories, and we do it in a way that we're kind of collecting them, and we can use them for donors. We can use them for advocacy purposes. We can use them for internal sort of culture building purposes. So as we're looking to share our story and help legislators really understand the impact on not just the folks we serve, but their families and what that enables them to do sort of economically. That's been a message that's sort of resonated with some of our legislators, especially in rural areas. That's kind of some of what we are doing in terms of using your materials.
Thank you, Margaret. And how about you, Chris? What advocacy tools are working for you?
Well, I think the storytelling is a big piece. And Bill, when we were at the Capitol for the Policy and Advocacy Committee, there was a literal story where a congressman, one of his staffers, connected with an actual story in Western New York here. His family member was in a facility that we tried to save that went under because the funding wasn't there. And then ended up moving into one of our partnering facilities. It made the advocacy so much easier. So, especially with people who haven't been in the industry long, or that, newer freshman politicians, the easiest way to get a hold of them is hit their heartstrings and not hammer them with the financials. One of the things we do a little bit of grassroots advocacy. So we're part of Leading Age, but really CEOs from across New York State, for-profits and nonprofits, came together, hired our own lobbyists to try to do some of these things ourselves. But where we lose them is saying, hey, we need this dollars and we need this, because then it's just noise. Telling that story, saying, unfortunately, this woman had to leave her home because it closed, because the state and the federal government could not match the costs. She had to leave. And that story can hit home. And I think that is very important. So that's where these pieces and, coming together around those things is much more effective. It's much quicker. And when you're meeting with politicians, you don't have a lot of time. And that is the quickest thing to get through to them. And then you want those follow-up questions. You want those, follow-up meetings. So I think the key with that storytelling, kind of like Margaret said, is to engage them, to draw emotion into it and not just demand and not just ask. So engage, and then you follow up with those other pieces. So that's, how those tools have been helpful.
That's great. Thank you. And we're almost running out of time. So I'm asking you a real quick last following question is, to your point, Chris, is the stories are the ones that matter. They get a connection to that. And that story, the impactful story of a representative whose mother's, grandmother's, how the actual nursing home closed. I mean, it had to be so impactful. But what's a trick to engage your families that you support or even the staff that you're working? Any last thoughts before we sign off for the day?
So we try to keep folks updated all the time. We have a monthly newsletter that goes out to both our family care providers, who are kind of contractors, and then host homes in other states, and as well as our developmental services staff. And so we're trying to update people all the time with information, stories. And then when we have an advocacy ask, they're used to hearing from us, and it comes from Holly, our VP. But we also reach out individually to staff members to say, hey, we have an opportunity to go visit someone in their office or invite people to a group home. Do you have family members? And they're the ones with those relationships on the ground. And usually they can come up with a number of people pretty quickly. And so that's been the thing that's been most effective for us.
Thank you, Margaret. And how about you, Chris?
I think for us, everything that Margaret said, I think the one thing we try to make sure we do is a call to action. So we want to make sure we have the transparency, we have the message there. We don't want to be alarmist, but we're open about, some of the difficulties that we do have. Let them know we are working on it. Here's the assistance we need. And the call to action is if you are familiar with your area assembly member or congressman, senators, what have you, to reach out. And if you're not familiar, make yourself familiar. Oh, by the way, we've got these tools. Here are these letters. I'm sure we're all aware sometimes letters can just get pushed across the desk. That face-to-face is the biggest thing that cannot get pushed across the desk. So those are the big pieces, I think, is that making sure that we're giving them the information, trying not to scare them, while being truthful, and then asking them directly for support.
Thank you very much. I wanted to make sure we got the full time through the questions. I really appreciate you guys presenting. And I think at the end of the day, we've heard that from legislators. At the end of the day, it's the people served that make the biggest impact in those stories. So appreciate that. We do have a closing poll for the people that have stayed on for the last minute. We're going to do that, and then we will close out for the day. And so the question following today's webinar, how would you rate your understanding of the changes connected to federal reconciliation and state level policy developments? And our numbers are increasing there. 3 very strong, 2 strong, holding there, and then we still have 3 people that are at moderate. We will follow up with all of the links from today's presentations, and we really want to thank all of our presenters and their commitment to continuing to inform our members where changes are at the federal level. So thank you, and everybody have a great day.